Ladies and gentlemen, what God cannot do does not exist. What my father cannot do does not exist. What God cannot do does not exist. Ladies and gentlemen, the most fearful, the most dreaded, and the scariest immunosuppressive disease can now be prevented. I present lenacapavir. Lenacapavir. This is lenacapavir. We all know that the human immunodeficiency virus, which is the HIV, if not properly managed, can lead to AIDS, the acquired immune deficiency syndrome. We used to have oral pills, either the pre-exposure pills or the post-exposure pills. Pre-exposure pills, like we see for serodiscordant couples and some healthcare workers that are at high risk. The post-exposure pills that we see for victims of etc. Needle pricks in the hospitals, they take post-exposure pills after being tested and they've tested negative to HIV. But these are oral pills. We find reported cases of adverse drug reaction for post-exposure pills, even pre-exposure pills. Some patients react badly because they have to take these drugs every day for the next 30 days, for the next 28 to 30 days. One pill every day, some people become tired, they become exhausted. And I've had a patient that took it for just 1 week and said, no, I will not take again. Let the HIV even kill me. That the side effect of the medication was even worse than the HIV itself, but that's not true. But just because of the side effects, the patient got tired and stopped taking it. Then behold, God so merciful, with the wisdom he deposited in man, a new medication came out, which is the lenacapavir. This kit comprised of both the injectable and the oral medications. The oral medications, about 4 oral pills in here and about 2 injections in here. Now, let me warn. Lenacapavir is a very sensitive injection. Now, only those that have the knowledge should administer. It's not an injection that you go and give an auxiliary nurse to administer for you. Let me warn. Only those that have the knowledge of this injection and how to take the oral should administer. Because this injection is subcute, and not just subcute, there are other tricks to administer this injection. Please consult a professional for this. Yes, also very importantly, lenacapavir is a twice yearly medication. There is a loading dose and there is a maintenance dose. That's why I say only those that have the knowledge of this medication should administer. Because it's not an injection you play with. Because of what you are trying to prevent is not what you play with. You can't give somebody air or give somebody placebo and expose the person to risk. No, it's very sensitive. So only those that have the knowledge should administer. Please take note. Only those that have the knowledge of this medication should administer. Here's how a kit comes. The oral pills and the injections. There's a loading dose. What is the loading dose? At your first contact with the patient takes 2 tablets of the oral pills. 1 tablet is 300 milligrams. 2 tablets is 600 milligrams. So patient takes 2 tablets of oral pills and 1 of the injections on either the abdomen or the thigh. Then the second injection also either the abdomen or the thigh. So patient takes 2 injections on your first contact and 2 tablets of the oral pills. That is day 1. And on day 2, the patient takes 2 more tablets. That is the loading dose. Day 1, 2 tablets. Day 2, 2 tablets. Day 1, 2 tablets with the injection. Day 2, just 2 tablets. Loading dose complete. Maintenance dose is 6 months later. Patient takes just the injection. Please follow those instructions. And if you need more information, contact us. Contact us. This is not an injection you play with, please. This is not an injection you play with, please. Don't give quacks. Don't give nurses that are not well trained. Don't give auxiliary nurses. Please contact a professional for this injection. If you have more questions on this, HIV in general, AIDS in general, I'm available for you. Just drop your questions in the comments and I'll reply you as soon as possible. I got you all. I got you. Lenacapavir has come to stay. Yeah, so just before I forget, lenacapavir is for HIV prevention. Yes, you can call it vaccine if you like, but we prefer to use the word HIV prevention. That's what it's for. And those that will be needing it, no matter what, even if you think you don't need it, please come and get it. If you're at high risk of contracting HIV, please come and get it. When I say at high risk, now, high risk people, sex workers, serodiscordant couples. What's a serodiscordant? Where the man will be positive, woman will be negative, or the woman will be positive, wife will be, or the woman will be positive, husband will be negative. Those are serodiscordant couples. Please, you need this HIV prevention injection and orals. For healthcare workers, you know you're always in the hospital, emergency physicians, emergency nurses, casualty officers. You're always being exposed to blood. Please, you need it. And a host of others. Please, you need this vaccine. It's for your own good. Sex workers, serodiscordant couples. Generally, if you know you're at high risk of contracting it, or you are in a place where the HIV prevalence is very high, Please come and get it. Come and get it. If you know you're at high risk, please don't sleep on this. Don't sleep on this. Send a DM and I will guide you appropriately. It's our work. I can't let you make mistakes. I can't let you get exposed. Serodiscordant couples, healthcare workers, or if you know you're in the high prevalence area where HIV is high, HIV prevalence is very high, please, you need this. You need this. You don't have to start taking pills every day. Just take your loading dose, take your injections, and you are good. It's in the subcute, so it's being released slowly. Please, don't sleep on this. Thank you.